Good morning. My name is Hank, and I am one of the original SteppingStones members, and I'm here today asking some questions of my friend Doug. Doug, first question on board here is, can you briefly describe your life before your brain injury? What was life like for Doug before the injury?
Okay, well, Hank, I was a store manager and a training manager for a drugstore company. I have a wife and 2 children. We used to do a lot of camping together.
Tell me a little bit more, a little intrigued on that. It's a drugstore that you were involved with, is that correct?
Yes.
Yeah, wow. Whereabouts? Where did that...
It's a drugstore chain, but I worked for one of the stores in Concord, New Hampshire.
Oh, all right. Good. I have a son who's with a drugstore as well, so I'm a little familiar with
I was a troubleshooter also. I would go in and fix stores that were having trouble.
The world of retail.
Oh yeah, gotta love it.
How long did you do that?
I was in this position for 15 years.
Wow. And was that your, how would you say, your primary job coming out of school? Is that one of the aspirations where you wanted to be?
No, actually it wasn't.
Okay.
I went to school for business.
Oh, did you? Okay.
Out of school, I went to work for the Marriott hotel chain.
Sure.
And I worked my way up from a housekeeping manager to a director of services for that chain.
Just living and learning and growing. That's great. Now let's turn to, here we are, SteppingStones. Can you describe your brain injury, Doug? When did it happen?
In September of 2003, I suffered a major stroke. I was transported to Frisbee Hospital. I was in the ICU unit, intensive care unit, for 7 days.
Where is that, Frisbee?
It's in Rochester.
Oh, is that right? Okay. And where were you transferred from?
After the hospital stay at Frisbee, I was transferred to Health South Rehab Hospital in Concord.
Oh, really?
And after 30 days there, the insurance company said that I was well enough to go to a day rehab center.
All right.
So then I transferred to Portsmouth Day Rehab.
Great. All part of a growing process then.
And then I spent about 6 months at Portsmouth Rehab when my insurance company said, okay, Doug, you're well enough to be on your own.
Wow.
My wife and I knew that I wasn't ready to be on my own, and we were informed about SteppingStones by one of the OTs at Portsmouth Rehab.
Oh, great, great.
So we had a visit here at SteppingStones, and I liked it. Had a meeting with Will DeGraw, the director, and
Right.
here I am.
You made it this far, and we're all happy to have had that happen. That's great. I think I'd like to ask about the communication challenges that you have What are the difficulties that you've experienced in communicating?
Right after my stroke, I had trouble talking because my vocal cords were weakened.
Oh, yeah.
But I was also a little more shy than I was before my stroke. I had become more insecure
I see.
since my stroke. But since coming to SteppingStones, and I've been coming to SteppingStones now for just over 1 year, I have regained some of my security and confidence.
And confidence, yes.
Because of the programs that they have here.
Great. It's a vital word that I think you use, showing that confidence that you gained from this campus and this community. That's awesome. Let's see, next on the line here would have to do with, I think, with some of the goals that you have set for yourself. From here on, you progressed, come nicely this far, and where does life have you going from here on in? How do you see that?
Right after my stroke, I never realized, I can't think of the word. I have trouble with words sometimes. After the stroke, I didn't realize the depth of my injury. But since that time, I've realized a lot of things. One of them was I wanted to get back to work at the job I had before my stroke.
Right.
But I realized during the time after my stroke that that was not going to happen. However, my time at SteppingStones, again, helping me with my insecurity and my confidence. As of last week, with the help of a group called Help Wanted, facilitated by an intern named Meg and another one named Lauren, I was able to go to my local hospital and interview for a volunteer job.
Excellent.
And the interviewer said that I was invited to an orientation meeting and a tour coming up in January. So it sounds good that I will get a volunteer job coming up in January.
Yes, excellent, excellent.
And that's all because of SteppingStones here.
Exactly, exactly. I hear you and I feel what you're saying too. I have a very high regard for life at SteppingStones. It's great to hear your version of that success as well. I think we've come to most of...
Let's see.
Is there anything I should ask?
You said the different rehab hospitals that you'd gone to. What kind of rehab did you receive?
At Health South in Concord, I received physical therapy, speech therapy, and occupational therapy.
And we talked about your communication, things that are hard when you communicate. Are there any other things that are a result of your stroke that have been challenges?
Yes. My entire left side is still pretty numb from the stroke. And my doctors have told me that that part of the brain is dead and that I may never get that feelings back on my left side. So that's a challenge and will be for the rest of my life.
How do you cope with that? Emotionally and physically, how do you...
The occupational therapists have helped me with strategies to get around not using my left side, especially my left hand. That gives me the most difficulties in my recovery. With my left leg, I can walk fine. When I walk, I can feel pressure. I just can't feel the sensitivity. But with my left hand, I have to be careful, like with cooking. But but they have taught me strategies on how not to burn myself with my left hand. Also, I have limited vision in my left eye, and what I mean by that is I have what they call left neglect, which means I am not aware of things on the left side of me, and sometimes I have to wear an eye patch, which helps me with double vision sometimes. So I almost have to move my head like an owl to get full scope of things.
Was that a difficult thing? So I'm not sure if there are any other members that have the left neglect. Was that something that was really hard to cope with, kind of losing one side of your body, or did you not really know until someone pointed it out?
I really didn't know until I would bang into something, or somebody would point it out to me. The occupational therapists and the physical therapists both told me that I always had to be constant on items on the left side of me, and to utilize my right eye all the time, looking to my left, because of the left neglect and the awareness or lack of. Most people's center of vision lies between their eyes as a center line. My center line is basically on the right side of that, almost center of my right eye, if that makes any sense.
Mm-hmm. No, it does. Hank, you've been coming here as one of the original members, like you said. Hearing Doug's story like this, how does that change? How does that make this more of a community? And also, Doug, how does telling your story make you more part of this community? Do you understand what I'm asking?
I think it's a matter of feeling how I think we're talking about from a membership standpoint. Here we are, members of a great organization. This SteppingStones is, I feel, a fabulous place to go. It's a fabulous group of people with whom to spend time. I think it's a matter of wanting to contribute, to try to give as much as I'm getting out of SteppingStones. Do you have any that sensation in your experience, how the role that SteppingStones is playing in your life?
Well, there are a lot of people outside of SteppingStones that just do not understand the scope of the injuries.
Right.
Of the brain. At least that's in my experience anyway.
Right.
My friends and my family just cannot understand what I'm going through, whereas the people, the members at SteppingStones, have that understanding. And which makes it very easy to talk to the members about,
right,
because we are all going through the same thing.
Exactly, yes, it's a vital organization. So delighted that this place exists and a place for us to interact with one another.
This is not only a good place for me to come to, SteppingStones is also a good place for my wife to come to, and understand, going through some of the groups that I go to and understanding a lot of what other members are going through. And she also gets to talk to some of the other family caregivers and understand what they're going through. so she knows that she's not alone
Exactly.
with what she's going through with me.
As much an education for her as
Yes, it is.
for you. That's right. Excellent. Now, let's see. Let's make reference to life since your injury, Doug. Impacting, for example, on your just family life and social life. And maybe touch a bit on your the effect that it has had on your belief system. How has that played a part in your SteppingStones experience?
Okay, let me see if I can answer this question. Go back to the beginning of the question here. How has it affected my family life? Was that the first part of the question?
I think, yes, family life, social, and that's when I fell into the belief system. So family.
In the beginning, after my stroke, I had experienced what my neurologist explained to me was brain distortions. So my brain was manipulating thoughts that were not actually happening. So I could not tell reality from false perceptions, and that put a real strain on my wife and my family. Because I was seeing her, let's say, how can I put this, having an affair with a friend of mine. And I was blaming her for it, and it really wasn't happening.
Yeah. Right.
And at that time, I wanted to kill myself, because if I couldn't tell what was reality and what wasn't, then why should I live? And in saying that, that put a strain on the marriage too, because my wife didn't believe. I was making my wife believe that I had lost her trust, if that made sense. And that put a big strain on our marriage. Again, that was all due to the brain injury.
Right. Yes, I can certainly understand that. I had a similar situation.
But we have gone over that. We've been through that, and that is more or less gone now, with the help of some counseling that I have
Good.
on the side, outside of SteppingStones.
Part of the growth process, I think you became a better informed you.
Through some counseling and through SteppingStones,
Right.
I know who I am, and I know who my wife is, and I know I can trust her. I know I love her. I know she loves me, and I need to trust that. I need to trust what my heart is telling me, and not necessarily what my eyes and what my ears are telling me. It has to all come from my heart.
Big time, yes. Go for that, yes. Therein lies strength. Great.
What about, you said you had 2 children?
I have 2 children, yes.
How has, how old, and, I mean,
I have a son that is 25 years old, and he is a staff sergeant in the Air Force. And I have a daughter who is 22 years old, who just graduated college this past May of 05.
Yep.
Great.
My memory is coming back.
And where did she graduate from? This is personal view here. I used to work in that field, and I wondered where she went.
She graduated from a school. It's a small school. It's called New England School of Communications.
Oh yeah.
It's up in Bangor, Maine.
Ah, right.
And she got her bachelor's degree in communications.
Excellent.
With a specialty in music engineering.
Really?
She wants to be in the technical end of making records.
Sure.
She wants to be an engineer and producer someday.
All right. She's
and as of today, which is December 7th.
Yeah, 7th or 8th.
05.
Yeah.
She has been hired as an assistant engineer at a studio called Allaire Studios, which is in Spokane, New York.
Really? Oh, excellent. Excellent.
So she's off to a good start.
Sounds like she's involved in something that she really loves and wants to be involved with. Beautiful. In New York. Oh, awesome.
So both my wife and I are proud of both of our children.
Yeah. They grow so rapidly.
Yes, they do. And I tell everybody who's going to have young children, or who have young children, to cherish them while they're young, and while they're growing up, because before you know it, they're either in the military or they're graduating college. They're gone out of the house.
That's right. Been there, done that.
Yeah.
Excellent. Well, I think that we've come to the conclusion.
I like to end each one with,
all right.
This is an oral history that's going to be heard by people that haven't had brain injuries, and also by people that have had brain injuries. What advice would you give to someone who maybe is still trying to come to terms with their brain injury? What could you tell them as having been there?
Okay, I've been there and I've gone through the hellish parts, and when anybody feels that they're on the verge of getting depressed, is to seek out counseling. Talk to somebody. It doesn't have to be a professional. It can be a family member or a friend or a neighbor, but make sure you talk to somebody and get whatever it is off your chest, because depression can only lead to worse things. And I've been there. I've had the thoughts of suicide, and please don't go there. Talk to somebody. Life is worth living, even with a brain injury.
Thank you.
Yeah, well put. And SteppingStones plays such a vital role, a vital part in bringing our lives back to the right road. I find SteppingStones to be important in my growth. So I'm
SteppingStones has played a vital role in my recovery.
There you go. Yeah.
There are plenty of people here at SteppingStones to talk to. They understand. In fact, I'll have to say that SteppingStones has saved my life after my brain injury. That's how important SteppingStones has been to me. And I think my wife can vouch for that also.
Very good, yes. I couldn't say that any better. I agree with you 100% though. For sure. It's great. They're wonderful. There are hurt brains here, but there are very healthy hearts.